Would you believe me if I told you this could be turned into this, and that this contraption could be used to monitor kids that are dealing with pulmonary conditions such as asthma and cystic fibrosis?
Well, that is exactly what is happening here at UCI in the KIND lab. Dr. Michelle Kine and her lab has innovated multiple ways to utilize the toy Shrinky Dinks. One of the most recent innovations using the toy was created by attaching a thin piece of metal to the Shrinky Dinks. Then this piece is attached to a stretchy bandage-like material so the patient can comfortably wear it. Two of these sensors are attached to the patient. One is in between the ninth and 10th rib, and the other is on the abdomen. This simple and cost-efficient device is able to send signals using Bluetooth that can be monitored on an app. This invention allows patients to live their day-to-day lives and go on and be active, yet still be able to track their health information. And this app can even help predict possible instances of pulmonary distress. I think what the Kind Lab is doing is amazing, and I'm interested to see other ways they're able to use Shrinky Dinks to help those that struggle with different chronic illnesses.
After reading the article about the wearable respiration monitor that measures breath rate and volume, I am reminded of a feature in the iPhone called Screen Time, which monitors how much screen time is used in a day and for what purpose. So, for example, today it says that I spent 4 hours and 53 minutes on my phone, and that is 50 minutes above my average daily screen time. And it also says that I spent 2 hours of that on entertainment, about an hour and a half on productivity, and an hour on social networking. Although monitoring screen time is not as impressive as measuring the rate and volume of respiration to help those with asthma, it still allows me to keep track of my screen time and motivates me to change my behavior. As someone who has bad eyesight and who has trouble sleeping at night, being able to easily monitor my screen time encourages me to minimize my phone usage for the sake of my eyesight and quality of sleep. This made me realize that a technological feature as simple as monitoring a user's screen time can have a big impact on one's health behavior change.
Information technology has been expanding worldwide and increased patient engagement in healthcare as well as creating a motivation for a positive change in health behavior. There has been countless of evidence that shows lack of patient engagement and cooperation that contributes to preventable deaths. Patients must be more active and become more involved when it comes to their own personal health. The use of information technology, or IT, has been implemented to mimic physician to patient interaction to encourage behavior change interventions. A systemic review displayed a 74% positive effect with the use of IT platforms on diabetic patients. Moreover, with the use of behavioral theories, we can identify important determinants of target behaviors and behavior changing strategies to better health outcomes. Understanding this knowledge will ultimately contribute to new behavioral strategies in which patients can utilize in their everyday lives.
So, to sum up, health technology continues to expand, providing new ways to care for patients. These health technologies include transforming Shrinky Dinks to a respiratory monitor for kids and utilizing IT platforms in order to increase patient engagement. In conclusion, utilizing health tech in one's everyday life allows patients to receive the best care by their healthcare providers. Physicians are able to better execute treatment plans in order to increase positive patient outcomes.